Did you know that diabetes mellitus can affect young adults too? It's a common misconception that diabetes is an ailment reserved for the elderly. Yet, the truth is far from it. Diabetes mellitus is a global health concern impacting millions of lives. In fact, young adults are not immune to it. There are two types of diabetes mellitus, namely type 1 and type 2. While type 1 is often diagnosed during childhood or adolescence, type 2 is typically associated with adults. However, both forms of diabetes can occur in young adults, presenting a significant health challenge. Early detection and management of diabetes are paramount. Recognizing the symptoms and understanding the risk factors can save lives and improve the quality of life for those affected. Diabetes doesn't discriminate by age. It's not just a disease of the elderly. Young adults are equally at risk. It's time to debunk the myth that only older adults get diabetes. Now, we're going to delve into the early signs of diabetes mellitus among young adults. Diabetes mellitus is a condition that can often go unnoticed until its later stages. It's like a silent alarm that only rings when the situation has become a bit too complex. But fear not, there are subtle signs that can alert you to its onset. One of the most common early signs is increased thirst and urination. The body tries to get rid of excess sugar in your blood by flushing it out of your system, and this can make you feel thirsty more often. As a result, you may find yourself visiting the bathroom more than usual. Another sign is unexplained weight loss. Despite eating as much as you usually do, you might find the scale tipping towards the lighter side. This happens because without enough insulin, your body can't use glucose for energy, so it starts to burn fat and muscle instead. Then there's fatigue. Feeling tired and listless? That might be your body telling you that it's not getting enough energy from the food you're eating. Without the right amount of insulin, glucose can't enter your cells to be used as a source of energy. Blurred vision is another symptom to watch out for. When blood sugar levels are high, they can cause the lens in your eyes to swell, affecting your ability to see. Lastly, if you've noticed that cuts and wounds are taking longer to heal, this could be a sign of diabetes. High blood sugar levels can affect your blood circulation, making it hard for blood needed for skin repair to reach different areas of your body. It's crucial to remember that these signs are often subtle and can easily be mistaken for other conditions or even just the stress of daily life. But these signs, like quiet whispers, can escalate into loud shouts if left unchecked. Remember, these signs are subtle, but they can escalate if left unchecked. While there are common symptoms, there are also some signs that are specific to type 1 and type 2 diabetes. Let's delve a bit deeper to understand the nuances. Starting with type 1 diabetes, this form usually develops quickly, often over a matter of weeks. One of the first signs you might notice is a sudden and unexplained weight loss. This occurs because your body isn't able to get energy from the glucose in your blood, so it starts to break down muscle and fat for fuel. This can result in a rapid drop in weight, despite eating normally or even having an increased appetite. Another specific sign of type 1 diabetes is a sudden onset of symptoms. You might feel perfectly healthy one day and then suddenly start experiencing extreme thirst, frequent urination, fatigue, and blurred vision. Unlike type 2 diabetes, where symptoms often develop slowly over time, type 1 diabetes symptoms can appear quite abruptly. Now let's shift our focus to type 2 diabetes. This form often develops slowly, sometimes over a period of several years. One unique symptom you might notice is darkened skin in certain areas of your body. This condition, known as acanthosis nigricans, often affects the armpits, neck, and groin. It occurs when insulin resistance causes an overgrowth of skin cells, leading to patches of dark, velvety skin. Another sign specific to type 2 diabetes is frequent infections or slow-healing sores. High blood sugar levels can weaken your immune system, making you more susceptible to infections. You might notice you're getting more yeast infections, urinary tract infections, or skin infections than you used to. Sores, cuts, or bruises might also take longer than usual to heal. In conclusion, while many symptoms of diabetes are common across both types, there are some signs that are unique to each. Recognizing these can be key to an early diagnosis. So, pay close attention to your body and any changes you notice. Knowing these specific symptoms can help in early diagnosis and appropriate treatment. Catching diabetes early can make a world of difference. That's not an exaggeration. It's a fact backed by countless medical studies and real-life experiences. The sooner diabetes is detected, the better the chances are of preventing serious complications. Early detection allows for immediate intervention and management, which can include lifestyle changes, medication, or in some cases, insulin therapy. Now, why is this so important? Well, uncontrolled diabetes can lead to various complications over time. These can range from heart disease and stroke to kidney disease, vision problems, and nerve damage. However, with early detection and proper management, these risks can be significantly reduced. Early detection also plays a significant role in maintaining a high quality of life. Diabetes, particularly when undiagnosed or poorly managed, can greatly impact your day-to-day activities. It can lead to fatigue, affect your ability to concentrate, and even your emotional well-being. But with early detection, you can take control and manage the condition effectively, minimizing its impact on your daily life. Now, you've heard us talk about the signs and symptoms of diabetes. If you or someone you know is experiencing any of these, it's crucial to seek medical advice immediately. Don't ignore the signs. Remember, it's not about diagnosing yourself. It's about being aware and taking that step towards seeking professional help. In conclusion, diabetes is a condition that requires our attention. It's not something to be feared, but rather something to be understood and managed. It's about taking charge, being proactive, and making informed decisions about your health. And remember, diabetes doesn't define you. You are not your condition. You are a unique individual with dreams, aspirations, and the potential to lead a fulfilling life. With early detection and proper management, diabetes can be just a small part of your life's journey. Remember, diabetes doesn't define you. Early detection and proper management can help you lead a healthy, fulfilling life.